not one or two people who are the union who make things happen. It's the patchwork of the strengths of all of our members contributing something.
I think having a strong union that really does advocate for patient care and staffing rights together, it's really what $11.99 is all about.
$11.99, number one.
Well, I started working as a nurse in the mental health unit at Group Health in 1981 and found that staff nurses really got short shrift. So we embarked on a search to see could we find an organization that would really help empower us and teach us how to advocate for ourselves and build a strong organization so we could stand up for patients and stand up for nurses.
I was house called by our now president, Diane Sosney. The first question was, how did you get my address and who are you?
It was an intensive organizing drive because we had a short window, but it was not a hard sell. Once we were able to articulate to our coworkers what the union could be like and actually show them examples from $11.99 nurse contracts from around the country, there was tremendous excitement. It was just palpable throughout the workplace.
We wanted a union of healthcare workers that was known for organizing and for moving standards forward. $11.99 has a great history, obviously, of doing just that for healthcare workers.
Now, we had a very strong organizer, director of organizing when we began, and that was Glenn Goldstein. He taught us.
It was just an incredible grassroots, unit by unit, staff member to staff member. We'd get together in somebody's house for an afternoon with the kids were all toddlers at the time and just talk to Glenn and just kind of convinced each other and shored each other up and then it really kind of took off and people started to realize it was the right thing to do.
In May of 1983, we won, and we won big. And that was important because we wanted to send management the message that we were united. Based on the success that we had had at Group Health, we got a phone call from a nurse in Yakima whose mother lived in Seattle who sent her the paper clippings, the newspaper clippings. We had envisioned ourselves being a statewide union, so we were excited to get this call from east of the mountain. That was a hard campaign. Management did not want the union there, yet the spirit that nurses had about wanting this change and wanting a voice was much stronger than management could suppress.
What happened in 1989 was that the group health nurses decided that we're at a point where we had enough power and the issues were strong enough. And group health also was deciding at that point to put us in our place. So we decided we would tell them what our place was.
So we took a stand, and the issues were there, and they were important, but probably more important was the fact that we said, you know what, the settlement is going to look the way we want it to look like, and you are going to have to start dealing with us in a more equal way.
And I worked on a labor and delivery unit, and I don't think the lights had ever been turned off. And I was on that last shift when we walked out the door and turned off the lights. I have to say I've never had such a feeling of power, of success, and pride at people who'd never done this before, who said, I'm willing to do it, and this is the right thing for us to do for our patients.
It was very empowering. We bonded. I think people became so much closer than we had been before.
The wonderful thing about being a nurse is that people have a lot of respect for your opinion. And certainly when a nurse is on the evening news talking about why we're on strike, we make a lot more sense than the CEO does.
And we made those gains.
As a result of the strike, we won really the first in the country low census language that protected nurses' income. And I can say since 1989, no group health nurse has ever had an involuntary low census day. If they took the day off, it's because they decided they would.
There was on the ballot, union, no union. Management lost, and then they didn't want to abide by the results of the election.
We were getting assaulted on a daily basis, and there was nothing done about it. We came out on strike because we feel like we need to discuss issues about safety as well as about us having a saying. Something has to be changed, and the only way things will be changed is to be organized.
We need someone to take over the security responsibilities so our responsibilities can be totally for patient care.
And all we're asking for is a collective voice, and this management is defying that or trying to define that and using county money to run this strike, and that's wrong.
The striking mental health care workers voted unanimously today on a contract and for the first time are part of the Service Employees International Union. It's a move many feel will benefit everyone in our community.
Today is day 138. The strike is now officially over.
There was really no stability and security for people that had been there for, had given long service there.
The contract assures these mental health care workers an immediate 4% wage increase.
Change doesn't come overnight. It comes over a long period of time, and I think I've come from a long way for changing management views and management listening to us.
And keep on wishing. Remember your dream is your only scheme, so keep on pushing.
Organizing Swedish nurses into our union was a very big turning point because it's a lead hospital. It is the largest employer of healthcare workers in the Pacific Northwest, and it sets the pattern.
We really needed to have a strong organization that could represent us and really stand up for patient care, because that was our bottom line. We wanted quality patient care, we wanted adequate staffing.
The fight for the first contract lasted over a year. It was a bitter battle, and we, as we often do, slowly the public became aware of the situation, and it escalated into this big march that was historic.
They're cutting us back so far that we can't take care of the patients we need to take care of.
When you're out in the streets and the public sees that, that is visible power that nobody forgets.
We negotiated the first staffing, really good staffing language, to do staffing by acuity. It gave us the ability to really set standards at a leading place, and once we set them there, to then have our other hospitals follow suit.
Just move on to a greater day.
Harborview is a very important institution in our community.
We had a department that had a horrible recruitment retention problem, and we asked for 2 additional staff members to be added, and they refused to even let that come to the table. They didn't even want to talk about it. So we did a campaign where we stickered up, and the stickers said, "Safe care needs full staff." People wearing the stickers, they were very popular, and they showed up almost everywhere in the hospital. And unfortunately, not always on the people. They were in the elevator walls. They were everywhere. And it angered administration there a great deal. And the very next bargaining session we had, they walked into the room and said, "We're not going to bargain today. The only thing we want to know is what's it going to take you to take the stickers off?" And we said, well, it's pretty obvious, more staff. And so then they agreed to 2 more staff members.
Just move on up. Move on up.
We organized with the vision, which we knew was not a short-term goal, to get collective bargaining for state employees so we could really impact that system.
We've had a contract with the state of Washington since 1988, but we haven't had collective bargaining for wages and benefits. And that's been an ongoing fight for about 14 years. When some of the legislators see those people in purple, especially people that they recognize, some of them keep walking and hide. And we finally won that fight in 2002. And we won that by lobbying the legislature, but also making sure that the people who were elected into the legislative bodies were the right people. Several hundred of us state employees went to Olympia the day the governor signed the collective bargaining agreement. It was fabulous to know that we were finally going to be able to open our contract and be able to do that, knowing that we could actually say, this is what the community standards are for wages and benefits, this is what we want.
I always bragged about the benefits and working for the Sisters of Providence. The sisters ran the hospital, and then they went corporate. They took away a lot of our benefits. They quit giving us raises. They started firing people that had been there a lot of years.
Nearly 50 people today held candles in support of Rose Gonzalez. Service Employees International Union officials say Gonzalez was unfairly fired. Gonzalez says she wants her job back, but not for the money.
Because I want to help the co-workers that work with me for a better environment, for a better working conditions. That's my goal.
So we unionized. It was the best thing we ever did. We went to the community, we told them what good staffing would create for them as being a consumer. It was the community members, including a Catholic priest, that actually pushed our first contract through.
And we have to pick at a hospital which calls itself Catholic.
Oh boy.
And right now it's not Catholic. That's why I'm here.
We are not going away until we have a fair contract, right? What do we want? When do we want it?
When we negotiated our contract, management kept saying to us, well, you know, you don't live on the west side. We can't look at their wages at all because this is the east side. Now that there's a lot more organizing going on the east side, they can't really say that. We could go to Spokane and say, well, look at their wages, look at their rates, look at their contract. This is a standard, and we think we deserve it and we should have it.
More than 1,100 Spokane nurses and technologists will soon vote to form a union. They hope to give themselves and their patients a better voice.
The intensive care unit and the emergency room at our hospital both sort of organized first.
We need to be able to have a seat at the table, discuss wages and benefits without having a surprise 9% wage cut.
I want to say it was around 60% of the RNs voted in the union for Valley Hospital. I feel good that we're organized now, and I feel like we're starting to go forward.
Oh, there is a lot of work left to be done, and I'm anxious to get started on it.
Well, actually, when I first came to Valley, the service and LPN units were separate from the RN units. We all pretty much came to the agreement that we would do better if we all became one bargaining unit, just be in the same boat together. So we had overwhelming support from the RNs, and Valley knew that when they were dealing with us, they were going to have to answer to the RNs as well as to us.
We have 3 contracts here, and one of the things when we got together that was the natural thing to do is just look at all our contracts and see how they went together, and we found a big benefit in looking to see where the best standards were right here in our own hospital, and found that while they were fairly good standards, they weren't all the same, and that there were things that we could immediately improve just by standardizing to our highest standard.
The most important thing we won in our recent contract was the weekend premium, and how we showed that it was unfair and unevenly how they divided the nurses from the rest of the hospital that had to work weekends, because the nurses didn't know. Until we started working together as one, it was never brought up as an issue between the 2 groups of people. But when it was brought up, it was a very important issue for all of us.
If they've already agreed to a high standard, it's hard for them to come in when a unified group says, hey, look, this is what we want for everybody. There's no logical argument for doing anything but going to the highest standard, and it's been really helpful.
When you come to the table, come fairly, because Not only do you have the nurses you're going to be dealing with, but you have the whole hospital. We're one.
Healthcare, even in the private sector, is a lot of public funded money. It's Medicare, Medicaid dollars, and that we have to be politically active.
It is unreasonable that we live here in America, the richest country in the world, and here we have so many people that are uninsured. It's absolutely ridiculous. It's ridiculous that we as healthcare workers, some of us, are struggling because we can't afford the healthcare that is being offered by our employers. We have got to fight for that.
It would be my hope that all the mental health agencies that 1199 represents could band together and move forward with one agenda. Take it to our legislators and educate them about what the needs are within the mental health system and what the fixes are within the mental health system. As mental health workers, we need to educate our coworkers who are not organized to build a stronger voice for ourselves and frankly for our clients too, because we're really charged as advocates for our clients too.
We cannot accept a governor who uses the budget to take some of our most vulnerable citizens and use them as the place to save money.
We need a governor that's willing to stand up and show the United States that, hey, my state is going to be one of those that have proven that we will provide health care coverage for all people.
Nobody should go without health care. It should be a fundamental right.
It is our time for health care. That is the issue this time around. We're sticking to that and holding all our politicians accountable.
I think we have an amazing union, and it's because we have amazing members. You can't have had the successes in an organization this big without our members having played the roles to make it a strong organization. It's what they do every day in the workplace.
$11.99, number one.